This is a presentation on basic care precautions for in-home care providers and clients in light of the COVID-19 pandemic. This is not medical advice. I'm not a doctor. I'm Lauren Reynolds, the founder administrator of at-home nursing care, a position I've held for 10 years. Previously, I was the investigative and consumer news reporter for 17 years. So it's important to me that you know the source of this information. It was compiled from information put out by the Centers for Disease Control, the California Department of Public Health, and the National Coronavirus Task Force news briefings. What is COVID-19? It's a virus which originated in the Wuhan province in China and then spread worldwide, which is the definition of a pandemic. It's highly contagious, airborne, and stays on hard surfaces. It's an upper respiratory disease, most dangerous for those 65 and older and those with underlying health conditions. It can be spread by someone without symptoms or someone who is asymptomatic. And it's novel, meaning new. Humans don't have immunity built up to this particular strand, COVID-19. Nurses and caregivers are essential workers. Clients are depending upon us to continue our quality care even in an emergency. But we have practice. We've trained for this. You are prepared, valued, and especially needed. Even with shelter-in-place or social distancing, including rules of not interacting in groups of more than 10 people, healthy caregivers and nurses should report to work as scheduled, make visits to their clients, but they must adhere to strict infection control procedures and follow CDC guidance. This guidance comes from the CDC. When making a home visit, home health agencies should identify patients at risk for having COVID-19 infection before or immediately upon arrival to the home. They should ask patients about the following: international travel within the last 14 days to countries with sustained community transmission, signs or symptoms of a respiratory infection such as fever, cough, and sore throat. In the last 14 days, if the person has had contact with someone with or under investigation for COVID-19 or are ill with respiratory illness, and people residing in a community where community-based spread of COVID-19 is occurring. We've made some short-term changes in our agency operations. The agency is open because we're coordinating the needs of clients, caregivers, and nurses. Does your client need groceries or supplies? Call us to help, and we are happy to deliver them. Our basic supervisory visits and recertification visits are going online or via phone to avoid routine visits with multiple clients in one day. If a client needs an RN visit, the nurse who responds will practice infection control. The agency, following CDC, is recommending that any client or employee who has symptoms of COVID-19, including fever, shortness of breath, and cough, to call their doctor. Do not visit an ER or an urgent care unless it's an immediate emergency or if your doctor tells you to go, because we don't want to have more people spreading the disease in ERs. Anyone suspected or confirmed positive for COVID-19 must be quarantined until 2 tests taken 24 hours apart are negative, but only those with symptoms should be tested for now. We've had a lot of changes in our society over the past week. On the federal side, it was recommended that non-essential workers, children, retirees should stay home as much as possible for 15 days, the idea being March 16th through March 31st, in order to slow the community spread. In California, bars and restaurants are only takeout. People over 65 and or those with underlying health conditions should self-isolate at home as a precaution. How COVID-19 is spread is person-to-person contact, believed to be airborne, and also touching infected surfaces. There is a general advisory to keep 6 feet of social distance between people, including no handshaking and no large gatherings. Caregivers and nurses are expected to limit their exposure even when they're not working, even when they're off duty. Avoid crowds, avoid touching unsanitized surfaces as much as possible. Stay home if ill with a fever or cough. When on duty, use personal protective gear as usual, especially if a client is ill, and then take extra precautions if COVID-19 is suspected. So, some housekeeping ideas. Upon starting the shift, the caregiver should wash hands for 20 seconds with warm water and soap. Run hands vigorously together. Wear clean clothes each shift. In fact, launder your clothes daily and change clothes if going from one client to another, which is discouraged at this point, except for nurses. Repeat hand washing at the conclusion of the shift before you leave, as well as several times during the shift. Begin each shift, if possible, with a cleaning regimen. Wearing gloves, use a household cleaner or disinfecting wipes to clean any surface people may touch. And remember door handles, including the front door, the handle both on the inside and on the outside of the door. I like to say, imagine you've touched raw chicken and then touched a bunch of areas around the house. Clean items such as the TV remote control, all countertops, refrigerator handles. If you are using wipes, be sure to follow the manufacturer instructions. Typically, using enough wipes to keep the surface wet for 4 minutes or letting the wipes sit for 15 seconds before rubbing that surface. Remember to wipe areas including the light switch, microwave oven handle, regular oven handle, faucet handles, the coffee table, dining table, the toilet flush handle, guardrails in the bathroom. If you are using a spray cleaner, use a clean paper towel or clean cloth to vigorously rub each surface, because using a dirty towel may simply spread the virus around. Be sure to also wipe down your own mobile phone and that of the clients if possible, as many people forget that those are hard surfaces and they are certainly handled multiple times daily. If a client has stairs in the home, be sure to clean the handrails each shift. Also, vacuum areas that the client uses at least weekly, and change linens and wash in the hottest water possible at least weekly or as needed or visibly soiled. Keep hand sanitizer in the client's home, in your purse, and also in your car if possible. You want to rub your hands vigorously together to kill the virus, and this is good as long as hands are not visibly soiled. If they are visibly soiled, you need to wash with soap and water. The CDC has some guidelines about hand washing. Healthcare personnel should use an alcohol-based hand rub or wash with soap and water for the following clinical indications: immediately before touching a patient, before performing an aseptic task, such as placing an indwelling device or handling invasive medical devices, before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and immediately after glove removal. These are not new guidelines. This is simply a reminder. Don't touch your mouth, face, nose, or eyes with unclean hands. And wash your hands after touching your face to avoid potentially spreading illness to others. Be sure that you are not running a fever. If a client has a fever, they should call their doctor for advice, not visit an ER, urgent care, or hospital unless instructed or unless it's urgent. Care providers with fever do not report to work until fever-free for 24 hours. If someone has a cough or needs to sneeze, be sure to do so into a tissue paper to catch any spray. Immediately toss the tissue into the trash and wash hands or rub together with alcohol-based sanitizer. If someone is presumed or confirmed with COVID-19, they need to isolate in a bedroom with the door closed. The estimate is about 14 days. The care provider should wear a gown, booties, gloves, eye protection, and a mask. The ideal mask is the N95, but due to a national shortage, a regular face mask is acceptable for now per the CDC. Most home health agencies provide infection control kits. We have them in our client's house just in case. Items in those kits being used typically are the gloves and the hand sanitizer. If someone is positive with COVID-19, other items in the kits that would be used include the gown and booties. Any caregiver or nurse assigned to work with a COVID-19 client will get specific training and equipment, including the N95 mask and also eye protection. If an N95 mask is used by a healthcare provider, remember to follow instructions based on the model number regarding on how to fit it properly on your face. Manufacturers even put videos on YouTube about how to make sure it fits correctly. This URL is for the 1860, but you can also just Google the N95 mask that you have and see how to fit it properly. Our agency-specific emergency preparedness plan has been initiated. We are practicing social distancing, so 6 feet of distance, plus constant disinfecting in the office to be able to serve you. You just need to notify the office of any extra support needed, including daycare issues, grocery issues, the need for more supplies. We are here to help. Just let us know. I recommend that you stay up to date, monitor daily news briefings, but get your news from credible sources such as the CDC, your doctor, local and state officials. And don't panic. We will overcome this invisible enemy and will be stronger for it. Keep your immunity up. Take care of yourself. Stay hydrated, drink enough water, eat balanced meals, take multivitamins if necessary, maybe an extra A and C, and follow your doctor's recommendations. Be sure you get enough rest, relax, and breathe. Continue physical activity at home and encourage clients to exercise as their MD recommends. Visit with family, friends on the phone or via Skype or FaceTime, but avoid unnecessary visitors or travel. And stay positive. Our economy will bounce back. Most people recover from COVID-19 with no medical help at all and very mild symptoms. We're taking this drastic action in our country to protect our elderly who have sacrificed so much for us in World War II and the Korean War and Vietnam. Our nation has been tested before, and we always come out okay. The older generations who are our clients now fought for us. Now we have to honor their previous sacrifices with the protection and service that they earned. Thank you so much for watching this, and be safe out there.